Hi students! Welcome to this guide on carving tooth when the upper right central incisor. This process involves creating an accurate representation of the tooth anatomical features, essential for dental students and beginners. In this video, we'll be teaching you a basic carving method for the maxillary central incisor with some useful tips and tricks for carving. So students, grab your tools and let's get started on this dental masterpiece. What you all need are the wax block, a lacron carver, a ruler, a wax knife, and a marker. And don't forget our anatomical model of tooth and wine. This is our wax block. What we are going to do is these blocks. Yes, first, you all need to measure 0.5 cm or 5 mm for the base of the block. Plotting it using a ruler and a marker. Start by marking a horizontal line. This will help you accurately plot your measurements on the wax block. Next, measure 1.4 cm or 14 mm for the crown, and the remaining is for the root. Now, you can start placing your measurements on each aspect using a marker and a ruler. Students, don't forget to repeat the steps on the other aspect also, okay? Now students, we have just completed marking 0.5 cm for the base, 1.4 cm for the crown, and 1.5 cm for the root. Now, dental creators, the next steps, you have to mark the sides of the wax block. LB for labial, L for lingual, M for mesial, and D for distal. Take your reference model of tooth and put side by side with the wax block, and start by outlining the shape of the tooth on the wax block using a marker according to each sides, which are the labial side, lingual, mesial, and distal side. Oh students, don't forget to outline the shape of the tooth on the occlusal aspect. This will help you as a guide to easily carve your tooth. Students, I just want to share, as a beginner, you can use your wax knife for initial carving, then move on to using the lacquer cover for smoother finishing. Keep in mind the shape of the crown from the mesial aspect, the labial outline being slightly convex while the lingual outline is convex at the cingulum and concave at the mesial marginal ridge. Now slightly convex at the incisor edge, where the outline as a whole begins curving toward the vertical line, creating a sharp incisor edge. On this side, students, don't worry to carve more or reduce the wax blocks more, because later on, we will also make a lingual fossa. Now, make a cut or a small notch at the marking on both proximal sides. These notches will mark the start of the curvature or the contour that we require. Don't worry about the curvature of the cervical line, it will be made later on. See, from the proximal side, we have got the bulge, so we need to reduce it. Be careful while carving in this angle, do not create a depression. Actually, I would suggest to rather avoid this angle. But whatever way it is, make sure to keep it flat. Now, we will give the curvature at the cervical line. Now, you can start carving the mesial aspect and distal aspect. Use your wax knife for initial carving, then move on to using the lacquer cover. After doing so, you can begin carving out the mesial and distal outline and defining these to incisor and mesial side of the ankle using the cover. Keep in mind that the mesial outline is straight while the distal outline is rounded, and distal incisor angle is more rounded than the mesial incisor angle. Then, use the spoon end of the lacquer cover to carve the cervical portions of the root. Now, also use the spoon end of the lacquer cover to carve out the lingual fossa and the marginal ridges, making sure the ridges are higher than the fossa. Now we are making the palatal concavity, aka lingual fossa, above the cingulum with curved end of the blade. Next step, we are looking forward to carve a root for maxillary central incisor. Using the end curve of the blade, cut or reduce the wax block following the shape that we outlined before. Just cut and carve until you can see the features of the single root. Next, mark the curvature line on the cervix toward the root, on the labial and lingual aspect. Then, carve it downward. Next, mark the curvature line from the cervix toward the crown at the vertical line. This will present the cemento-enamel junction. Here, you just need to create a single depression on the root at the mesial aspect. For the detailing the anatomy, you may add the developmental groove and mamelons if applicable. Carve any subtle details that characterize the natural tooth structure, such as the labial and lingual ridges. For finishing touches, smooth out any rough edges and refine the contours using finer tools. Compare your carving with reference images or model to ensure accuracy. FYI, the labial surface should be smooth and slightly convex. The lingual surface is concave and has a prominent cingulum near the gingival margin. Here's the final touch. Take any toothbrushes, start by cleaning and brushing your tooth one until it looks clean and free from dust. This is how your final tooth should look. This is how your final tooth should look like. Keep in mind that it's okay not to get it right from the first time. You can make mistakes. And remember, practice makes perfect. If you have done carving tooth 1-1, fantastic work, dental creators. You have just carved an impressive tooth 1-1. Each carve enhances your skills and deepens your understanding of dental anatomy. Keep practicing and let your carving skills continue to dazzle. Here's to many more exciting dental adventures. Hope you find this video helpful. If you like the video, please comment, like, share, and click notification for any updates. Bye!